comfortable turning off your camera, you can do that. Okay. So today is our 5th general meeting. So we're very close to the end. SPA will be done sooner than the actual semester will be over. We have this meeting and then we have 2 more left. And then all those dates you can find on our Rowdy link. You can find them on our YouTube, on all 3 of our social media platforms, and you can also find them in our group chat. Okay. So just a few reminders, membership dues are due today. You can find the information regarding how many dues you need to pay in the next slides, and then you can also find them again on all our social media forms, our Rowdy link, our YouTube, and the emails we send, along with the group chat for SPA. If you need to talk to me regarding membership dues, then you can do that and we can figure something out. Yeah, I'm open to whatever if y'all need to talk to me about that. You have until midnight, unless you need an extension, just let me know. And then officer applications are now open. We did open them during this weekend, I believe. So if you are interested in a position, let me know. You have to send me your email, and that's how I will send the officer application. Okay, so membership requirements, just really quickly, back to the officer positions. We sent out a flyer in the SPA chat. It was also posted on our social media platforms. So we will send it again tonight if you're interested or want to know what positions are available. If you want to know more information about the positions, then you can send me a message and I can let you know a little bit about that. Okay, so membership requirements. Again, all this information, we've been posting it from the start. So attend 3 out of 6 general meetings. I know there was like 2 or 3 people that messaged me regarding membership. They just joined. It's a little difficult to start now because we're already like pretty much done with the semester. But if you really want to be an active member, just send me a message and we can figure something out. But here's all the information. Again, membership dues are due tonight. So 15 for returning. You must verify with Fernando. So returning membership basically means that you were an active member the previous semester. You must complete active membership every semester to continue to be a returning member. So say you completed the requirements 2 semesters ago, but not last semester, then you're a new member. If you have questions about that, you can send me a message and we can discuss this further. If you're a new member, then it would be 20. And if you're an alternative member, it would be 25. I also sent out the cord sign up last week. I will send it out again tonight. And then it should also be included in the recap email. So please make sure you sign up for cords. I will give you all a deadline, but I would say probably until November 10th. But I will let y'all know for sure. A lot of y'all have already signed up, so thank you. Please make sure to sign up. Again, you only qualify for the cords if you complete active membership. So if you have questions about that, send me a message.
So these are our social media links. It'd be a good idea to give us a follow on all of them, but 2 important ones are going to be our YouTube and our Rowdy link. The YouTube, we post these meetings to after the meetings are done, and then the Rowdy link is how you receive our recap emails every week. And then, I'm sorry, our group me as well is where we do updates. You can get that QR code right there. And then we have some virtual volunteering opportunities that we do. So we have letters of encouragement to the San Antonio State Hospital, the Children's Shelter, and through Love for the Elderly. 1 letter equals 1 credit. You don't have to send us the contents of the letter, just of you with the letters mailing them out. And then we have 7 Cups, which is an app that you can download. You kind of just talk to people. It's like free online therapy. And then we have the UTSA pantry. I think it's actually 6 items equals 1 credit. And they give you a slip after showing you the number of items that you donated. You can send us a picture of that. And then we also have monetary donations to our organization. $6 equals 1 credit. And then we also have in-person volunteering events. I believe we have Morgan's Wonderland or Satellite this weekend, and then Morgan's Wonderland next weekend, both on Saturday. Satellite's really fun. You get to see like horses. We've cleaned saddles and like just done things, whatever they need us to do around the center. And then Morgan Wonderland, we haven't done that one yet, but it is upcoming. And that one's from 9 to 2 p.m.
So we were also emailed last week from the San Antonio State Hospital. We used to volunteer there, but because of the pandemic, they weren't allowing volunteers or big groups. So we weren't able to do any in person. However, they just told us that they are doing a volunteer opportunity on November 6th, which is the same day of Morgan's Wonderland. So what we decided to do is give y'all both opportunities. Alexis will be doing the San Antonio State Hospital and Ethan will be doing Morgan's Wonderland. So you can sign up for whichever one you want. So here's the flyer. Again, this will be sent out everywhere and it's going to be from 8 a.m. to 12 p.m. And Morgan's Wonderland is from 9 a.m. to 2 p.m., I believe. Yes, okay. Again, sign out sheets will be sent out as we get closer to the date. So for the ones this Saturday, I will send them out tonight and they will also be on the recap email. Mariah.
Yes, sorry, I had to unmute myself. So here are meetings. The remaining meetings that we have is today, or I'm sorry, November the 9th, the Growth Lab meeting with Dr. Lawson. And that's also the day that our membership requirements are due and officer applications will be closed. Then we will have our end of semester celebration on November 23rd. And then our graduating officers and members are presented and new officers are introduced. Our events remaining are a professional development event that's going to be on November the 4th. And you're going to learn how to create a CV, write a personal statement, build a resume, and perfect your LinkedIn profile. And we have one last social, and that's going to be our campus scavenger hunt. That's going to be from November 15th to the 18th. And a list of items is going to be sent out and you will complete the list. They'll be posted in our social media and our GroupMe. You're going to post pictures of the completed tasks on Instagram and tag us, and each completed task equals 1 raffle entry. Here's our merchandise. We have our double-sided masks and they're super cool and they're pretty thick. They're $7 each. We have our t-shirts, they're $20 each. And then we have our tumblers, they're $15 each. Our thermal mugs are $20 each, and our water bottles are $15 each. And how to pay for those items. We have Venmo and we have our Cash App. So please be sure to include the correct code in the description when sending member fees and purchasing merchandise. That just helps the process go a little bit smoother. Our Venmo is at SPA20 UTSA and our Cash App is SPA20 UTSA. Now welcoming Dr. Shelby Scott.
And the share screen is available as well.
Okay. Hi. How's everyone doing today? Thanks for having me. I'm Dr. Shelby Scott. Maybe I'll introduce myself a little bit. I'm an assistant professor here in the psychology department. and I'm one of the SPA co-faculty advisors. So it's really nice to be with all of you. So I like to just, before jumping into like presentations and stuff, I just like to check in with everyone and just how many of you were here? Let's say this, I presented to SPA, I think earlier this year or last year. How many of you are new to just like seeing me present anything before? You can just do like a reaction, like thumbs up if you're new, versus I'm curious if there's any of you that kind of saw things before. Okay, cool. So some of you are new to hearing what I'm about. Okay, awesome. Because I kind of don't want to bore you with like the same information that I said last time. So to tell you a little bit about myself, my research focuses on couples and families, and in particular, LGBTQ couples, families, and kind of the different unique aspects of their relationships that may affect their outcomes in terms of relationship quality, how it might affect their mental health. And so this is really what I focus on. So I have a little presentation for you all today, where I can tell you a little bit about my lab, but feel free. I mean, I love to make this interactive. Feel free to jump in if you have any questions or if anything kind of comes up as we go through this. So let me start this presenter view here. Okay, cool. All right, and then make sure I can share my screen. Beautiful. Okay. All right, y'all can see my slides. Okay. All right, oops, sorry, I forgot to change the title on there. Anyways, so to tell you a little bit about my background, I'm from Texas originally. I went to the University of Houston for undergrad, but I'm actually from Dallas. And then I got my PhD in clinical psychology from the University of Denver in 2016. And so what that means is I have a degree where I got training in both research and clinical work. And so I worked in a research lab that really focused on couples and families more broadly, but almost all of their studies were on mixed gender couples and kind of heterosexual folks. And so I kind of am one of the earlier researchers, believe it or not, that have really been focusing on same-sex couples and particularly couples with transgender partners. And then I came here to UTSA last year. So I started in January of 2020, right before the pandemic hit. So looking forward to seeing many of you in person at some point. The research mission of my lab is to reduce health disparities in marginalized populations with a focus on how we can do that through couples and family relationships. And so I really want to enhance the resilience within couples and families that come from marginalized backgrounds. And a big focus of my research is also on how we can improve relationship services for marginalized couples and families. So that's things like how we can have better clinical recommendations, how people can adapt their interventions to serve couples from different backgrounds. And so within my lab, I call my lab the Pride Family Studies Lab, which stands for Promoting Resilience in Diverse Family Studies. As I mentioned, most of my research has been on same-sex couples or same-gender couples, mostly female same-gender couples. I have some projects right now that focus on trans couples where one or both partner identify as trans. And also just recently published as a co-author an article on African-American couples and kind of racial identity and what that means for African-American couples and partners. And then I have some research on veterans as well. And I was at the VA for 3 years as a clinical psychologist, and I'm working with some colleagues on some research on veterans as well. And so basically, I'm interested in how all these different factors, race, gender, sexual orientation, and LGBT families, how they affect couples and their relationships, and also how things like sexual and gender minority stress affect relationships. And then with African-American families, how race-based stress affects relationships. So to just tell you a little bit about my interests here, and kind of why I'm so interested in couples and families is there's a lot of research that shows that relationship quality has what we call a bidirectional association with health outcomes. And bidirectional means that it goes both ways. So in other words, if you have really good, healthy relationships where you have a lot of satisfaction in your romantic relationships, you're more likely to have good health outcomes. And those health outcomes include things like better mental health, less alcohol use, and less chronic conditions. And at the same time, if you have healthy individual health, you're also more likely to have healthy relationships. That's where kind of this bi-directional relationship comes in. And then the opposite is true. So if you have poor relationships, poor romantic relationship quality, or have a really hard time keeping consistent relationships or having relationships that are healthy, you're more likely to have some of these negative outcomes. So it really is something that psychologists have recognized is associated with how well you're doing as a person, your mental health, your physical health, all of that. And in recent years, we've seen a lot of increased support for female same-sex couples and same-sex couples in general. We've seen, just 6 years ago, believe it or not, it was only 6 years ago that same-sex marriage was legal on the national stage. Versus kind of going state by state that was determining if same-sex marriage would be legal. And all of those things are really good. But at the same time, there's been an increase in backlash against sexual minority rights. Even today, like literally today, there was a law signed into law in Texas that's banning trans students from playing in sports. There's lots of different kind of anti-LGBT laws that have been proposed throughout the country. And we actually saw a real increase in that in 2017 and 2018, including hate crimes. So even though they've made a lot of progress, there's been some recent backlash. And then when talking about the LGBTQ population, and more marginalized groups in general, we know that this idea of minority stress has a real impact on people's mental health and individual well-being. And so minority stress just really refers to the chronic forms of psychological stress, oppression, marginalization that people from marginalized groups experience. And, these come in a lot of different forms. They can come in the form of just what's culturally considered normal, right? They can come in the form of overt oppression and discrimination, microaggressions, all these things that I'll talk about soon. But what I really want to just emphasize is all this additional stress leads to health disparities. So if we talk about LGBTQ people, there are higher rates of depression, there are higher rates of anxiety, there are higher rates of substance use, there's higher rates of suicidal ideation and attempts. And these are all a result of these additional stressors that LGBT people have to live through. And so the term specific to sexual minority people's chronic stress is referred to as sexual minority stress. And so just to break this down a little bit, you can break down kind of oppression towards marginalized groups in a few ways. I'm going to focus on sexual minorities right now. I'm sorry, my dogs are barking. I think there's someone at the door. But with sexual minorities, they have to navigate through heterosexism, like just kind of the ongoing conceptualization of human experience in heterosexual ways, right? So these are everything from just the way that gay, lesbian, and bisexual people, pansexual people are invalidated, ignored, kind of considered different. The ongoing kind of stress related to how sexual minorities are typically not considered the norm. Think of media, think of movies you watch, think of, politicians and leaders in your life, most of what's kind of presented is this idea that heterosexual orientations are the norm. Homophobia is a bit of a stronger term that refers to individual anti-gay attitudes and behaviors. This is kind of more of this like aversion to non-heterosexual people behaviors. And then we also have transphobia. That's more specific to people who identify as transgender. And I just like to mention that, again, all of these things can come in different forms, and they can be overt, like physical and, verbal abuse, discriminatory laws, bullying, rejection from family and friends. With transgender people in particular, there's much higher rates of violence towards transgender people than almost any other population or demographic. Transgender people are also more likely to live in poverty or be underemployed or unemployed. And also, oppression can come in these more covert and subtle forms that are hard to recognize. So these are things like microaggressions. This is a common one I get. People assume I'm married to a man and I'm not, but people will be like, oh, what does your husband do? Or, I have a daughter, they'll say like, what, where's her dad, or things like that. So just kind of the assumption of heteronormativity. This can come in the form of nonverbal behaviors like staring, and just like lack of full recognition of same-sex relationships or LGBT relationships. And then also daily hassles, like the additional work it takes to find an LGBT provider. And I like to mention all these examples because these are so important, because these oppressive experiences can become internalized. People can then have negative perceptions of themselves for not being heterosexual or cisgender. And it can lead to a lot of consequences, like all those mental health disparities I was just talking about. So one of the primary goals of my research is to think about, with couple and family interventions and therapies, how we can modify them to be more culturally compatible with same-sex couples and transgender couples in particular. And so when I talk about cultural adaptation, it's this idea that we can take treatments like couple therapy treatments or relationship intervention treatments, and we can modify them to be more specific to the groups that we're trying to serve. And there's some good research on race and ethnicity, that if we adapt our interventions to be more specific to the cultural norms of different racial and ethnic groups, they work better. But there's been less focus on how we adapt interventions for LGBTQ couples and families. So I think just like a question through a lot of my research is, are evidence-based treatments made in one context? Do they apply to another context? And kind of this balance of what's universal across all couples and families, and what might be unique to couples and families based off of their gender composition, like if they're a same-sex couple or a mixed gender couple, or what might be unique in terms of the cultural values of different groups that makes us need to change the way we apply interventions. And so, I'm not going to go through all of this today, but this is this approach that I take with all my research. I like to kind of know what the state of the literature is. I like to do qualitative focus groups and kind of see how we can improve our interventions. Then I like to build the basic science and then develop interventions and then refine them. So I'm not going to go through all these steps today. That would be a much longer talk, but this is kind of the general approach of my research. Is I want to build more culturally sensitive interventions for couples and families that haven't received as much attention in the couple and family literature. So I thought for today, I'm not going to go through all of my research because I would probably bore you to death, but I might be able to share a little bit about 2 studies that we've been completing here at UTSA. One of them focuses on female same-sex couples. And as you might notice, sometimes I say female same-sex couples, sometimes I say female same-gender couples. Can you hold on one second? Hold on. Sorry, y'all, there's chaos going on in my house because I have dogs and a toddler. So there's lots of chaos happening at this time of the day. So, okay, anyways, I'll just talk about the study. So when I was in grad school, I recruited a large sample, about 103 female same-gender couples. And then we were able to do a follow-up with these couples once I started my position at UTSA. And so we have actually one of the longest studies that's been following female same-sex couples. This is a 7-year longitudinal study. And this research is really important because there's actually been some research that's come out suggesting that female same-gender couples are at higher risk of divorce and breakup compared to both male same-sex couples and also mixed gender couples. And there are some different reasons that this might make sense. We know that in mixed gender couples, women are just more likely to file for divorce if they're unhappy in their relationships than men. Women file about 2/3 of all divorces compared to men. So women just might be more likely to leave relationships when they're not happy. They tend to be a little bit more affected by negative relationships than men do. But regardless of the reason, I think it's really important that we have some research that shows what's associated with healthy long-term relationships with this group. And so, as I mentioned, we recruited about 103 couples. This is some of their demographics. They kind of started a mean age of being in their 30s. They'd been together for about 2 years. It was a primarily white sample, but we did have some kind of good representation of Hispanic and Latina and some African American, et cetera. And when we followed up with these couples, 7 years later, we were able to contact 93% of the original sample, which is really awesome. We were hoping to contact like maybe 70%, but we were able to get in contact with them. And we looked at 2 different questions. And so y'all are some of the first to see these results because we're just trying to publish them right now. We looked at folks who did break up and asked them, why'd you break up? What happened? What were your reasons for breaking up? And then we also looked at our predictors at wave 1, which again was 7 years ago, to see what predicted breaking up at wave 2. And we found some interesting results from this checklist of reasons for breakup. We found that over half of the couples listed conflict and arguing as one of their main reasons for breaking up. And then the other factors that were highly endorsed were infidelity, sexual satisfaction, and commitment, kind of all at similar levels here. And then there were also, the list was longer than this, but the other ones that were endorsed at a pretty large amount were household labor and substance abuse. And so you might be wondering, okay, that's interesting. What do we take from that? Well, the interesting thing to me is I did a very similar study with mixed gender couples in 2013. And the results were almost identical in terms of like the top 3 reasons. So mixed gender couples also tended to report that conflict and infidelity were the top reasons, and also commitment, which was one of the 3 top reasons as well. Yeah, there were some differences, sexual satisfaction was pretty high as well, but there wasn't enough on any of the other factors that, it wasn't like one other factor was really, really high, that was really, really low in the other one. And so it kind of makes this case that there's probably more similarities than differences between couples in terms of why they break up. And also within this study on female same-gender couples, I added some questions really specific to being a same-sex couple, like discrimination for being a same-sex couple, coming out to other people, like were any of those reasons that you broke up? And some people did, but the results were really small. Like it was less than 10% on all of these sexual minority specific variables. And so that to me, again, is just interesting. It doesn't mean that they're not important, but they're at least not what people identify most clearly as their reasons for breaking up. Maybe it contributed to those other reasons like stress and communication and all that, but it wasn't what they identified when given kind of a list of reasons. So this is actually good. This says that maybe there are more similarities than differences between couples, which makes it easier to use the same type of interventions we normally use. And then in terms of what predicted breakup at time 1 versus time 2, we had a lot of variables we could look at. And so we kind of divided them into 4 categories. We had kind of these unmodifiable baseline characteristics like demographics and age and whether the couple was living together at time 1. And then we divided things in ways that kind of match different interventions. So for example, a lot of relationship-focused interventions focus on things like relationship satisfaction and dedication and communication. So we kind of put those all together. Some interventions are for individuals, like depression interventions, alcohol use interventions, anxiety interventions. And then there's this kind of 4th level of what we would call external things like social support, sexual minority stress. Some of you might be taking classes that use the term ecological models. If you don't know that term, that's okay. But it kind of taps into this idea that there are different levels of influence. There's the individual level, the relationship level, the societal level. And so we kind of divided our predictors in this way. And that way we could say what's most important, what really makes a difference in predicting whether couples break up. And to give you the simplified results, we found that the ones in bold were predictive of breakup. So the baseline characteristics, the relationship characteristics, and the external characteristics were predictive. They added predictive value, but the individual characteristics didn't. So again, I could go into a lot of what we think this might mean, but I would just say the unmodifiable characteristics are useful for identifying couples most at risk of breaking up. Like if the couple, there were other characteristics in there that I didn't list out, but like, are they living together or not? Do they have kids together or not? How long have they been together? These can help identify couples at risk of breakup. The relationship functioning variables can all be targeted through couple interventions like couple therapy and relationship interventions. Maybe the individual functioning variables are less helpful to focus on. It's really more how the couple works together versus how each individual is doing. And then maybe we can find ways to reduce the impact of sexual minority stress. So lots to still be seen about where we go with this research. But this is kind of where we're at with this project. So I know I'm kind of going a little quickly through this because I also had another study I could talk about, a transgender focused couple study, but I want to pause with you all and just kind of see like, do y'all have any questions about my research on female same-sex couples? Would you prefer to hear about the other study on transgender couples? What would be helpful for y'all? What are you most interested in?
I have a question kind of about what you're talking about right now. Was
Yeah.
there like certain, as you said, unmodifiable characteristics like that were like I guess stood out more than others? Like was age really important or like
Sure.
Like which specific ones?
Yes, I can pull that up really quickly. Give me 1 second. Let's see, breakup prediction paper and table. 1 second. Okay. So sorry, one second, Alexis. Here we go. So what I'm showing you here, Alexis, can you see this table?
Oh, yeah, I can.
Okay. So these are all of our predictors. You see how many there were, which is why we kind of did this. It's way more than I need to get into, but instead of doing each one at a time, we put them in these blocks and we saw which block added predictive value. But we can still look at the individual correlations. And so anything over here, y'all haven't taken stats classes, I'm sure, but anything over here that is below 0.05 means it was significant. So, and this is the R value. So the bigger this number, the bigger it was predictive. So to summarize, like age was one of the biggest predictors. So the older the couple was, the less likely they were to break up, which makes sense. That means you've probably been together longer, right? If you look at income, the higher income the couple was, the less likely they were to break up. The higher educated the couple was, the less likely they were to break up. We did find this interesting finding that if the couple, either partner had a lot of previous sexual partners that didn't, female sexual partners that increased their risk for divorce. Oh, and then here's relationship length. So that was the strongest, it looks like, of all of them, right? So the longer they had been together at time one, the less likely they were to break up. Yeah.
Yeah, that's super interesting.
Mm-hmm.
Yeah.
And so these are all of our predictors, but like I said, I didn't want to really go into it too much, but we looked at communication, we looked at sexual satisfaction, we looked at these individual predictors. So yeah, we were able to kind of break it down in these ways.
Awesome. Sorry, I made you dig through that.
No, thank you. I'm like I said, y'all are the first ones I'm presenting these findings to. And so it's good, you know, in different presentations, I'll add more information because I'm sure those will be of interest to other people. Okay. So any other questions about this study? Otherwise, I can share a little bit about our trans couple study. But please, if you have a question, please ask. You did. You got exclusive look, Mariah. Great. Tavia has a question. How do you apply this to counseling? So that's a really good question. So when I look at these results from this paper, like I mentioned, what we called the relationship block or the dyadic block added predictive value. So that means that when we think about how communication, relationship satisfaction, breakup likelihood, like we asked people, how likely are you to break up? That those were really predictive of whether the couple broke up. The good thing about that is that most of these variables are typically addressed in our current relationship interventions, right? That is typically what we work on in couples therapy. We work on improving communication. We work on improving commitment. We work on improving feelings of closeness. You might work on sexual satisfaction, obviously reducing any and all aggression. So that means that the core part of our relationship interventions are probably something that would work similarly for same-sex couples, for female same-sex couples. The additional piece, though, is we did find that this sexual minority stress block, which is what I called the external block, we kind of use different words for different reasons, but that it also added predictive value. So it's interesting to kind of think about, if you remember with the couples, when I said, why did you break up? Not many of them actually mentioned sexual minority stress reasons, but when we put them in a model, they did predict breakup. So for me, my kind of interpretation of that is sexual minority stress probably is having some impact on couples and whether they stay together or not, but it might not be in ways that couples easily identify, right? It might not be like when you ask a couple, hey, why did you break up? They're going to be like, oh, I had a lot of internalized homophobia, you know, like they're not going to identify that. Or, you know, I faced discrimination at some point. But there's probably some trickle down effect of experiencing more stress, causing more maybe conflict in the relationship, maybe causing more just frustration. I mean, think about when you're stressed. Like, are you your best partner to your partner if you have a partner when you're under a lot of stress, right? So I think this is the piece that I'm still interested in. How might this be addressed in couples therapy and relationship interventions? Social support, though, could be another one too. That's outside of the relationship, like friends and supportive relationships. So maybe that could be another part of intervention that might be particularly helpful for same-sex couples, right? How do we improve your support network if maybe you're less likely to have one because you've maybe experienced rejection or something like that from your own family? Yeah, Maria said they would have to be pretty self-aware to realize it. I agree, right? And so maybe it's not the most easy to identify, but it's still having an effect. So we want to kind of think about that. I don't quite know yet exactly. There's one intervention I helped create years ago that was kind of focused on female same-sex couples. And we did include a unit on increasing social support. And we also included a unit on coping with stress kind of broadly. So that could be maybe one idea. But yeah, we'll have to see exactly how it shakes out. Any other questions on this? It's exciting to hear y'all's questions. Makes me think more about it too. Okay, the transgender study. Okay, I just want to pause because I'm like, and just want to make sure people aren't just going along with it because I'm going too fast. Okay. So with our transgender study, can y'all see my slides again? Okay, thanks. Okay, so this last year we recruited a sample of a little over 20 transgender adults who at some point during their gender transition, which was very broadly defined, they were in a romantic relationship. So that could mean they started to socially transition, like presenting themselves as the gender they identified as. It could be that they started gender affirming hormones. It could be that they went through some kind of surgery. But the main criteria was that everyone was a transgender adult, and at some point during their gender transition, they were in a romantic relationship. And we just kind of asked questions. I did all of these interviews myself and recorded them. We transcribed them, we coded them. We wanted to understand, how does being in a romantic relationship affect that transgender person's experience while they go through their gender transition, as well as how did the gender transition affect their relationship? So we wanted to identify both strengths and advantages and also some challenges. So this is a qualitative study. I won't go into all the ways we coded it, but I will just say I had a coding team. About half our team was transgender. The other half identified as queer or LGBT in some capacity. I think that's important to really mention when we talk about coding, because we kind of bring our own biases and experiences to it. So in terms of challenges, what is difficult about going through part or all of a gender transition while in a relationship? So some of the different challenges that folks mentioned were really, the top one was around negotiating sexual identity and labels. And so to kind of explain this theme got to this idea that when someone goes through a gender transition while in a relationship, usually they and their partner have to figure out, okay, what does that mean for us in terms of how we both identify our sexual orientations, right? So sometimes it can be helpful to think of an example. If you had a female same-sex couple who got together when both partners were identifying as female, and one partner starts to transition from female to male, and, says, hey, I'm actually a transgender man, and that's how I identify, and starts to make that transition. His partner might have to think about, well, what does that mean for me in my own sexual orientation? Maybe their partner identified as a lesbian, and now their partner is transitioning to male, right? So she might have to think about, okay, am I okay with this? Am I still attracted to you? And that can vary. Some people are very, what I call monosexual. They're really only attracted to one gender. They're really only attracted to femininity, or they're really only attracted to masculinity. So if their partner is changing in their presentation and their identity, some questions can come up about what that means for them. And also for the couple as a whole. So what does that mean? Like, you went from being what some people might say is a lesbian couple to now what could be perceived as a heterosexual couple, but maybe that doesn't feel right. So interesting things can kind of come up around that. We had this theme of centering the partner who's not transitioning. So some of the participants said they were really concerned about how their partner was doing, if they were okay with it, if they really love them, if they really were going to stay with them, be attracted to them. And kind of centering their needs, or maybe even not transitioning or slowing down their transition until their partner was ready. Another theme that came up for some people was processing loss and grief. So for some couples, not all couples, maybe one partner had to go through some grief of their partner transitioning and feeling like they were losing in a way, their partner in the way they knew them for a different way that they know their partner, right? And so kind of what does that mean? Some people felt insecure about their current relationship, even if their partner was very reassuring. There was this insecurity of if the relationship's going to make it or last. And then some participants shared that while transitioning, they could experience what's called some gender dysphoria. So for those of you who this term might be new to you, this gets to the discomfort, the emotional distress that some transgender people feel between their gender identity and their body, right? So it could be like, if you, in that example I gave, if someone was a transgender man, but he still had if he still had breasts or, female genitalia, and he's in a romantic relationship, gender dysphoria might come up in different ways, particularly around sex and intimacy. And so that was something that couples had to really talk through, and could be kind of challenging at times. Okay. And then one other theme was the effects of hormones. And there's some research on this, kind of varies, but if the transgender partner was starting to take hormones, there's some research that it does affect your mood, especially in the beginning at first. If you're taking testosterone for the first time, people tend to be a little bit more irritable. There can be changes in sex drive. If someone is transitioning to more female, they are taking estrogen, they can tend to be a little bit more, kind of similar to when many women start to have menopause or experience like even their periods and things like that. So there can actually be some effects of the hormones. And there's some research that gender affirming hormones can affect, some people notice changes in their sexual attraction when they go through hormones as well. They might notice themselves attracted to other genders that they've haven't been attracted to before. So I could go through this more, but I'm giving a really brief kind of overview here. Okay, and then the very last one was navigating boundaries with family and family of origin, and how to tell their families how their families of origin were reacting to that, and that could really vary as well. So those are the challenges. Happy to talk through any of those a little bit more. We haven't even written these papers up yet. So these are just from the coding that we've done. I will say our sample was a very heavily white sample. So we're actually opening up our recruitment again to try to recruit, in particular, some Black trans folks and some Asian trans folks because we didn't have that represented. So we're going to still recruit a few more people, but then we'll hopefully get these published next semester. And then in terms of the strengths and advantages, which I always like to emphasize as well, some participants said they felt just super validated by their partner and their identity as being a transgender person or non-binary person. That made them feel great, that they found it to be a very affirming process to go through. Open communication definitely helped promote that. So, couples being very open with each other about what language to use, what body parts are okay to touch, how do we present to the world, how do we come out as a trans couple to family and friends. That was very helpful. Couples that had more social support, they also noted that that was helpful if they had a community of family or friends that were supporting them through this transition. And some of the participants also mentioned this idea of partner advocacy, that they found it very helpful and affirming if their partner would advocate for them. So that could look like, let's say the couple goes out and they meet someone new and that new person misgenders the partner who's transitioning. That it could be very helpful if their partner said, oh no, he goes by he pronouns, or actually his pronouns are this or that, so just kind of advocating for them and with them was very affirming. If partners sought out additional education on this process, that was considered very affirming. If they looked up resources and, showed that they were really on board with this process by getting educated about it. And some couples even mentioned that this process made them closer than ever to one another because the partner who was transitioning was really living their authentic self, their authentic truth, and they got to kind of know each other on an even more intimate basis. So that's our qualitative study. And I'll just say we're actually now working on a quantitative study, which is where we're going to try to kind of almost do a similar study to what I did with the female same-sex couples, but with trans couples. We're not going to do 7 years, but we'll do like 6 months apart to start, where we're going to try to recruit 100 couples with at least one trans partner over 2 waves and kind of look at some similar variables and see what predicts positive outcomes and more negative outcomes. But let me pause there. Any questions about my work with trans couples? And I'll also just say, by the way, when I was a clinical psychologist at the VA, I was also the LGBT veteran care coordinator. And so I saw a lot of trans and LGBT veterans, including a lot of couples who had a trans partner, or sometimes both partners were trans. So I have some. So any questions on that research?
So I know that you said that you did all the questionnaires yourself. Would you say that it's better to have one person do all the questionnaires instead of multiple people, so that way you have like the same level of answering that question over and over again?
Yeah, and so that's a good question. So I did all of the, yes, I did all of the interviews, but we had a predetermined, what we call semi-structured interview. So I was asking the same questions to everyone. And, it's a good question, like, would it be better or worse if there were some other people doing the interviews? In some ways, there could be an advantage to having different people. Different people might ask different questions and get to nuances and, kind of might diversify what's being asked and all of that. The advantage of having one person do all of them is it's consistent, right? So you're having the same approach to asking the questions, the same types of follow-up questions. So it's consistent. So you can kind of hone in on the same types of questions and answers and themes. So I tend to try to lean on consistency, because sometimes if you have different people like if you had 4 people doing these interviews, the data might be so broad and different from one another that it's hard to find themes across all of them. But that's a personal kind of research question choice. But a good one.
Gotcha. Thank you.
Mm-hmm. What else are y'all wondering about?
Maybe you could tell us a little bit more about your clinical experience with the VA, since I know a lot of people are interested in going into the VA.
Mm-hmm. The VA, yeah, let me know if you have a specific question around that, but I did a lot of my practicum training at the VA. So when you become a clinical psychologist, you have to get some experience outside of like your university clinic. If you have a university clinic, you have to do what's called practicum experience. So I did that for a few years. And I also worked for an entire year for my internship year, which is it's like kind of like a residency with med school. You like do an intense 1 year somewhere else. I did that at the Palo Alto VA in California. And then for 3 years, I worked at the Denver VA. Yeah, I'm happy to answer specific questions, and I'll be honest about the pros and cons about it. I think there's some real pros to working in the VA. It's a government job with consistent pay, with consistent hours. You work 40 hours a week. You get to come home and completely not work. Most people can't even check their email when they leave the VA. Maybe that changed with COVID, but you get there's financial benefits, you get a pension after you retire, and you get to serve a population that, it can be very fulfilling to work with veterans and their specific needs. And there's also some cons depending on what you find to be a con. So like for me, it was just a lot of clinical hours. You just had to see a lot of patients, and I was doing a lot of trauma work. And so I think it just wasn't for me. Like, I think I light up more around research and just like answering questions and investigating those questions. But I'm happy to talk about any questions folks have about what it's like to work at the VA, if anyone has a specific question around that.
Did you see any difference between like LGBTQ couples in the military versus civilians? Because I know that, we had Don't Ask, Don't Tell for a very long time. So was there any difference?
Yes. So I will share, these are my anecdotal experiences. So these aren't research findings. I can share about my specific findings. But yeah, it's a unique population because due to Don't Ask, Don't Tell, many of the couples I worked with, the veteran, for at least a significant portion of their life while they were in the military, was not able to live out as their own, as an LGBT person, right? They had to keep that a secret. Many LGBT veterans have a lot of terrible experiences during Don't Ask, Don't Tell. Even though the name is Don't Ask, Don't Tell, many people were directly asked and were outed and experienced trauma even around that. So, and then with trans veterans, and I'm noticing we're kind of at the end of the hour, that repeal was very recent. It was repealed. The transgender ban was repealed in 2016, then reinstated kind of in a messy way from 2017 to 2019. It was reinstated, and then it's just been repealed again this year. So with almost all transgender veterans I was working with, they served during a time they couldn't be out as trans. And so many of them had partners who knew them and maybe even started their relationship before transitioning. And so that was a more common, I think, occurrence. So yeah, more trauma, kind of stigma, maybe internalized stigma, fear, bad experiences around being gay or lesbian or bisexual, et cetera.
That's unfortunate.
It is unfortunate. Yeah. And, you know, even after Don't Ask, Don't Tell was repealed, it doesn't mean all the stigma and homophobia and, you know, wasn't like everyone in the military accepted that with open arms. There was a lot of resistance to it. So I think that has a lot of correlations with like lower social support, right? If you can't come out, if you can't live authentically, by default, you have less social support because you can't make authentic connections with people, right? Like at the same level or with as many people. So yeah, there were some differences. So I know we're at the end of the hour, so maybe I'll be quiet, but hey, I just wanted to let y'all know if you have any questions, you can follow up with me. I tend to take 1 to 2 independent study students each semester. I had a bunch of applications for next semester that we've kind of already gone through, but if folks are really interested and motivated, shoot me an email. You might still have time to kind of apply, or you can apply even for next year if you're interested in that too. Or like next fall. So just shoot me an email. Yeah, thank you all so much for your time. Anything else? All right, are we done, Alexis? Are we wrapping up or do y'all have anything else?
I think that's it. Just membership dues are today. And then if you want to be an officer, send in your officer application. That's all I have to say.
Also, I know a few of you asked me about your requirements. We're gonna get the roster updated. I know several people sent in dues today. So I will be messaging people individually towards Thursday, Friday, just keeping y'all updated with your requirements. And again, if you're interested in officer positions, send me a message so I can send you the application.
Is that a dog growling?
Yeah, he's playing with it's because I gave them the lick mat, and so they're like fighting over it, but it's like a large one, so there's no reason to fight over it.
Oh my gosh, that's funny.
Yeah, they're annoying. It's my Pomeranian.
Alexis, you cut your hair. It looks so cute.
Thanks. I got it today.
Cool.
I appreciate
You're like,
it.
I'm gonna be on camera, so I need to look my best.
Yeah. No, actually, my mom's turning 60 on Thursday, so I wanted to kind of like surprise her.
Aw.
Yeah.
She's gonna be like, Mija, where's your hair?
Yeah. Oh well.
I'll see you guys later.
All right, yeah,
Bye.
see you soon.
Bye.
Bye.
I'm staying behind a little bit in case anybody wants to